So, day one, I got to get used to this selfie stick. It's about 4 o'clock in the morning, can't sleep, there's a big storm coming. This video is not gonna make it. I just woke up. The flight is 7:30 or 7:45, leaving out of Greensboro. I wanted to help during Katrina, and I never did it, and regretted ever since. So I'm gonna be journaling every day, taking a lot of pictures while I'm in New York. Not sure what I'm gonna see. I'm hoping to see a lot of people working together to do something special that this world hasn't seen in a while. Not in my generation. Got so much support from family and friends. I'll probably talk about that later. And I've never done anything like this before as far as talking to a video camera, so my country boy accent should go a long ways in New York. Should probably shave. Yeah, I'm winging this. I don't know. So we'll see how things go. I'm gonna finish this coffee and finish packing and see what this storm's gonna do. Right now it's just windy, but they're calling for some heavy thunderstorms and high wind. So I may get delayed. I've got to fly from Greensboro, layover in Chicago, and then Chicago to LaGuardia. Should be in New York by 1:40 if things go well. So as this thing goes, over the next 4 or 5 days, I'm accessible on Facebook. See ya shortly. That first day I got to go out and learn the logistics and transportation of New York, and that's something I've always enjoyed when I go to Raleigh or Charlotte, is to try to find your bearings and how do you get around. And usually I would start whenever I go to a new city, just take that morning walk with my coffee, look around, try to get a map, see where I wanted to go while I was at these new cities, and just learn how can I get there by walking or biking, and if I needed to use a cab or a bus or subway, and as far as New York goes, was the way to go. The subway would get you a long distance, and then you could get off and decide if you wanted to walk or bike or whatever, and that's usually what I did. The first day I ran over to CUSNS because that was one of the place I wanted to see that ship really badly. Unfortunately, they had it tight security around that ship. They had covers where you couldn't even see unless you were on high ground, and then they had security to where you couldn't get near it unless you had the right clearance. That morning I met FEMA. When I walked outside at 6 o'clock, there was about 15 FEMA personnel, and these were volunteers from different states. Most of them that I met and talked with were paramedics that had volunteered to come down here, and they were taking, on that day, 911 calls, which was one of the paramedics said that was really stressful. very busy, but she was very glad to have volunteered. She was from South Carolina. I also met another volunteer from Illinois, and I think another from Kansas, actually. That first day was, my first time being in New York. I was just kind of blown away about how the energy and the vibe, even with New York being on lockdown, I could tell it was a great place. Just looking at the murals, the art, and what people were out, they were very nice and culturally diverse, and that's something I've always been. I like to see that. I like to see the culturally diverse. I like to hear the different languages, the different music, different food. This is a boring world if we didn't have that diversity, and there's so much to learn from a diverse culture, and you just have to be receptive to that, and not be afraid to learn new things. Or see different viewpoints. I think that's another reason I really love New York. It was eerily quiet, and I had nothing to go by, but in the days to come, I would get different people texting me or contacting me saying that this was really hard to watch in some cases, and others were just like, it was eerily quiet to not see or hear, the normal noise level or traffic, or people walking through the subways. So people telling me that, and I know just by judging from how busy Charlotte and Raleigh can be that this was very unusual. Also, on my first day working, as soon as I got down there, as soon as my flight landed, the founder from Green Top Farms, Josh Lee, called me and said, "Hey, you coming?" And I really wanted to unpack and unwind and eat and take a look at the city, but I was like, that's why I came down, was to help them out. So I went straight to the kitchen, kind of got a quick orientation, which basically was you put a mask on as soon as you get there, you wash your hands, you put your chef coat on, and then you put an apron on top of that. If you don't have a hat on, you got to put a hairnet on, and you jump in. You jump in and you try not to slow everybody else down, which I took one of the most basic places in the assembly line, which was cutting vegetables, cleaning, peeling, cutting, and they do it in a style where it's something you'd see from a restaurant, where these vegetables can't just slice and dice them. You had to do it a certain way, because the chef wanted to maintain his meals, even though they were mass producing them to send to the hospital. He had a certain way he wanted to have them prepared. By the end of that first day, I had already gotten my first blister, because just repetition of using that knife and cutting, and standing in that one place and not being used to something like that. I was tired just from 4 hours. Just got off work and the sun is out, so that's good. I'm tired. My hands hurt. And going back every day after that, we started the morning packaging meals. That was the first thing you did, was packaging. Usually, I think it was 500 meals that first day, and they've gotten up to 2,000 meals a day now. That's a lot of meals. And then after you package, and you go on to preparing the food, preparing the vegetables. Everybody had a job to do as far as what foods were being made. Mine was preparing the vegetables, and also cleaning, mopping, sweeping, just wherever I could help out without getting in the way. So I also got to interview Josh Lee, the founder of Green Top Farms, who is part of this Queens Feeds Hospitals, and he's actually a North Carolina native. Super person. I'd never gotten to talk to him. Even the first 3 days I was there, I didn't get to talk to him because we were so busy, and he was out doing his delivering and keeping the everything stocked up, and just the whole being a manager and keeping things running outside of the kitchen. He was very busy. Also got to interview Anup, who was the chef. Just super person. He's has a style of leadership that is very respectful, and he keeps everybody motivated and moving. and everybody likes to work for him. I kind of got an earful, and people telling me how much they like working for this kitchen as opposed to other places they had been. So that was nice to hear. And Josh's take, I didn't realize Josh and I had so many things in common. He's tried to keep a small footprint in the environment with his farm to table supply line. I'm hoping to consult with him later on and see what we can do in Rockingham County and bring the general public with better quality fresh foods that come from our farmers, local farmers.
We were a catering company up until about 6 weeks ago, doing a lot of office catering, preparing the food here at our kitchen in Queens and then delivering by bike to offices in Manhattan. And we have since shifted towards home delivery, making packaged meals, bundles of prepared foods that we deliver to people's homes, and also raising money to make individual meals for donation to several soup kitchens and food pantries and hospitals in the city.
What kind of foods are y'all packaging right now?
So I would call it farm to table. We draw inspiration from all over the world, but the ingredients we try and keep it as local as possible. So local chickens cooked in a Indian way, or local vegetables cooked in a really French or Asian way. I guess that's the theme, and also the supply chains that we're not. If a poultry processing plant, if one guy gets sick, you can't process chickens. That's a big deal. But in the middle of a farm, you're getting vegetables, and that's less of an issue, I think.
How many meals do you think you've been making every day this week?
So we have gotten up to almost 1,000 meals a day.
Wow.
And we'll do more than that next week.
That's amazing.
It's a gradually just figuring out our systems on our end, and how to order, how to prep, how to package and deliver all this stuff. It's totally new, a new operation for us. So we started out with a couple hundred meals, and we've worked our way up to 1,000. We hope to keep going.
Yeah.
I've never used a selfie stick before.
I know, it takes some getting used to.
We were a farm to table catering company up until about 5 or 6 weeks ago, when offices in New York City started shutting down, and we have since pivoted to. Well, now we have an online grocery store, amazingly, thanks Al, and through that we're sending raw and prepared food to New Yorkers, to people all over New York. All the food that we make is farm to table, meaning that the majority of it is locally sourced. We source as sustainably as possible. We like to say sustainability is a direction, not a destination. So we're constantly trying to make our processes more sustainable, from our electric bikes to our waste reduction initiatives in the kitchen, to composting, to the packaging that we use, to not wasting time or money. So everything is focused on not wasting anything right now, and that's just a core component of sustainability anyway. We're hopeful that this crisis can actually be a turning point where, when the food system is starting to show a lot of cracks, that it can be built back in a much more sustainable way that is more resilient during times of crisis, but also produces more nutrient-dense food, or food, if you just want to call it that. We got to get away from the calorie factories that are factory farming, and back to small, local, family farms growing sustainably. If we do that, then we could do a whole lot of good, feed more people, reduce food insecurity, and if we really did it right, we could eat our way out of climate change by turning every farmer in the world into a carbon sink and sucking all the carbon in the atmosphere that we put in there since the Industrial Revolution. Personally,
or just any.
Personally, I spend a lot more time by myself.
Yeah.
When I'm not at work. I'm actually very grateful that we are considered essential workers. For Green Top, this has it's really challenged us, and I think it has brought out the best in our team. And our whole team, I think the morale was probably down for a couple of weeks because there was so much uncertainty.
Yeah.
And now things are starting to take a little bit of structure and form in a way that is manageable. I like our new systems. We're starting to get better at them, and but it's been a tough pivot. It's almost like mid-season they were like, "All right, guys, we're not playing basketball anymore. Here's a tennis racket." With the catering, we were sending everything family style, and now family style is off the table indefinitely. No one's going to be eating family style for a while. So we've gone to individual boxes. In a way, it's been exhilarating to see how people respond during a crisis. And I've been very heartened by the way people, especially in food, have responded. Folks that we don't know, have never met, are now some of our biggest champions. They're sending us orders, they're sending us places to donate. I picked up 2 carfuls of donated produce from a couple restaurants I've never even been to, but I really want to go to now because it was very high quality produce. Blue Smoke and Untitled at the Whitney Museum. And we'll have more of that stuff coming. And then we have, I'd say I probably get a text once or twice a day from a different person. Hey, I love what you guys are doing. I want to volunteer. How can I help? And so now we're putting together a volunteer coordinator and reaching out to folks in the community to make sure that this essential work doesn't go down. One way it's really affected us is that our food safety department is now a food and people safety department. And the procedures and protocols we've had to implement just to keep people safe are above and beyond. I mean, most well-run kitchens with a food safety plan are already much safer and much cleaner than the average household kitchen.
Yeah.
We've taken that 5 levels up in the fact that everyone, mandatory wash your hands as soon as you come in, even if you go outside for a smoke break or just step outside for some fresh air, come back in, wash your hands or sanitize. New gloves between everything, between any sort of switching or station switching. And everyone, our whole crew has been wearing masks now, I think, 4 or 5 weeks. Almost immediately we were able to get some masks, and we've had some donated reusable masks, which have been helpful. And so we want to do everything we can, not just to protect the individuals on our team, which we care about very much, and would be devastated if something happened to someone. We've already had a couple people who had to self-quarantine just because they may have been exposed outside of here. But it's also about protecting the kitchen and the work that we're doing, because if we go down, next week we'll have between 5,000 and 7,000 meals that we're sending out to hungry New Yorkers or struggling families or people at a homeless shelter or hospitals who are working overtime and being overstressed. And if we go down, that's 5,000 to 7,000 people that don't eat.
Yeah.
So that's I won't say it's heavy, but it's definitely a motivating factor, and it keeps us focused and working on the cause, because sort of the whole reason we got into the business in the first place. Everybody on the team is very mission driven. We preach sustainability all day, every day, and this is really exposing how unsustainable our current food system is, and hopefully a lot of folks will recognize that and push towards a more sustainable food system in the future.
Local, buy local. That's going to be I'm hoping, the new normal. And we're seeing now how essential food supply is, and what it was like when you can't go to Food Line, when you can't go to Walmart and everything's sold out. And I'm sure local would be tough too, but the more local we can produce, the better for the environment, better for us, better for our communities. Keep the money in your own communities. I think I captured just how well everyone worked together and produced all these meals, packaging the meals it was very efficient. And as soon as these meals were packaged, everybody jumped right back into preparing the next day's meals, getting a jump start. It was every day like that. I'm sure they're doing the same thing now. And their goal was to ramp up even more food and get out even more plates daily.
The next stop is 57.
Definitely looking like a tourist right now with this selfie stick. This is where I'll go to get back on my subway. Everybody's got their mask on. Most everybody. Hard rock. Definitely need to come back and get some dinner from some of these restaurants. Okay, it's getting chilly out here, so I'm gonna find a slice and go home and watch some Netflix. I guess thank New York. I've tried to social distance as well as anyone here, because the last thing I wanted to do was come up here and spread the virus any more than it already is. I love New York because of its diversity. I love it all. And albeit a wounded and sick New York, this is a very resilient city, as we all have seen, and it will recover and be stronger than ever. The entire nation is healing right now, and we're gonna all become a stronger nation as long as we don't repeat our mistakes, and if we don't take a new initiative to find a new normal in life. Yesterday I was it's just weird being out roaming around New York. You can cross the streets at any time. You don't have to wait for the light to turn or the crossing lanes to open up to pedestrians. I mean, you just go out there and cross the road, and people are riding bikes going the wrong way. They don't even pay attention to the streetlights. A lot of bikers out there. I'm seeing a lot of hospital staff walking around, going to work, jumping on buses, jumping on the subways. See a lot of them in their scrubs. I spoke with a physician yesterday. Had the time waiting. We were both waiting for our meals downstairs in the deli, and he is an ICU physician. And he was telling me the worst part for him is watching these people die without family being there, because they can't allow family in there. So if they know the patient is going to die and they have time to bring some kind of video device in there, then they do that. But some of these patients are so close to death the whole time they're in ICU that you don't know when their time is come, and sometimes it's not the staff doesn't have time to set up a video, contact the family member or friend so that they can be there when they pass. And the ICU physician actually teared up. Talking about that. All right. All right, I got some notes here. So also, I just walking around, I feel safer in New York than I do in North Carolina. Everybody knows here. Everybody here knows someone that has died or has been sick, and so they respect it, and they social distance and do the things they're supposed to do. So I feel safer here than home. Yesterday, going in at 10 o'clock every morning to work, it was a goal-oriented time. You come in, you washed your hands, put your mask on, and you jumped into an assembly line that was a well-oiled, just very efficient way of packaging these meals, of just how well it worked. And these guys know what they're doing, and I hope to continue to see them find new ways and just improve and keep doing that conservationist and keeping our environment in mind. And they're doing a wonderful job. I can't wait to see where Josh takes this. But again, I do want to stay in touch with Josh and consult with him, because I want to take some meals to our hospitals, to our frontline healthcare workers. And healthcare workers doesn't mean just doctors and nurses. It's the CNAs, it's the registration, it's administration, it's the environmental services that keep everything clean and keep the virus off of the surfaces and air. And it's everybody there. It's the people keeping the air conditioners and the electricity on, and the plumbing, all of it. So and they're there for a reason. You don't become a healthcare person, a doctor or nurse, before the money. If you're in it for the money, you're not going to stay there long. We're here because we love people and we care about them. So social distancing means a lot and keeps us all safe. Back to the farm to table and feeding our communities with healthy meals. I would like to hear from anybody in Rockingham, Caswell County, or any of our surrounding counties that would be interested in helping that. I've got cardiovascular and diabetic patients that are having a hard time finding healthy foods. I think a lot of us are. It's too easy to go to fast food, and we're clogging our arteries, or we're sending our sugars sky high, and these diabetic patients can't even afford their insulin. So I mean, If they had better food, they would use less insulin and diabetic medications. So these healthy meals like Josh is making with Green Top Farms and any of these local farm-to-table suppliers, it's hard to beat. Also, if you're one of my patients, then you know I am big on natural ways to improve your health, such as diet, exercise, stretching, yoga, mindfulness, and meditation. So these are all, even now, these are all very helpful and key for you to focus on while you're spending so much time at home. And along with that, something I've seen here in New York is all of its biking lanes, parks. There's almost everywhere you go, there's almost a street width of lanes for pedestrians and bikes. And I didn't see any accidents, and everybody's just zooming back and forth, going all over the place, walking and biking. It's not just subways and cabs and buses and cars. People get around and get a lot of good exercise that way. I would love to see Rockingham County have some biking lanes and more paths, more trails. Make it more feasible and more accessible to get out there and get this exercise and fresh air and sunlight. We need that. It gives people more room to social distance, and that's going to be key going forward. We're going to see our government reopen with less restrictions in phases, but social distancing is probably going to last and stay with us for years to come, and we're going to have to learn that and embed that in our way of living, especially during flu seasons, especially if you know someone is sick. If you know you're sick, you got to consciously go out there and protect your neighbor, protect that stranger from you giving them something that nobody wants. So it's going to be a whole new mindset for us all, and that's going to be a good thing. Like I said, we can socially distance ourselves instead of socially isolating ourselves. And with that, that's what I'm saying about these places, parks and trails and getting outside. We don't have to isolate ourselves. We can go do these things. Right now, I'm able to work from my computer. I've been doing that since I've been here. I've been on call this entire week as a provider, after hours and weekend provider. I take the calls if a patient calls in after hours and if they need anything. So I've been doing that remotely with my computer, and that's the way everything's going right now is telemedicine, telehealth. If you haven't used it, it's the future, and you need to do it. I guess now's the time for me I'm with James Austin Health Center. I started that about 1.5 years ago. Very lucky to be a part of the James Austin Clinic. A whole nother documentary should be made on Dr. James Austin and everything that he represents. He was a very well-known figure, healthcare provider, primary care in Eden, North Carolina. He took time with his patients. He was very selfless, often seeing patients and not getting any money in return. But the patients would offer gifts of some sort, maybe food. I've heard a lot of different things, good things about him. So I was very honored to be the provider there and continue to be there. We are currently now under Caswell Family Medical, and just another blessing for our community. Billy Crumpton is our director, and the guy has just the biggest heart and skill to just what he brings to our community and support. You will see in the coming years as we grow, and I just can't say enough about how lucky I am as far as James Austin and Caswell family and the medical, my colleagues there, and the support. They're top notch. We're starting a new system called DoxyMe. It's a platform to see our patients via telemedicine. This keeps patients from having to come in. I mean, you don't want to have to go to, if you've ever sat in a doctor's office, especially when it's really packed, you're around everybody coughing, sniffling, sneezing, and a lot of times you go to the doctor, you thought you were sick, but you weren't, but you definitely left sick because you picked up something new. My daughter is a frontline nurse in the emergency room at Wesley Long, and as of April 20th, it officially becomes a COVID-specific hospital that the way Cone is restructuring, and it makes a lot of good sense. But my daughter is on front line, and not only is she a full-time emergency room nurse, at the end of the day, she goes home where my dad, her grandfather, is immunocompromised with stage 4 cancer. So she is doing everything she can to keep him safe, and we need everyone else out there. I don't, if you're healthy and your family's healthy, that's great. We want to keep them that way, but think about all the other people, all the other folks that won't do well if they get infected, and that is a lot of people. You don't have to be older. You don't have to have all these comorbidities. We're seeing a lot more susceptible demographic getting this, especially here in New York. I'm told you're seeing younger, presumably healthy people that are getting this and dying. So social distance. I mean, we're here now. I mean, we're social distancing. We made it this far. Let's not loosen up just yet. We're almost there. And the tighter we can social distance and wash our hands and be mindful, the quicker we can get back to a new normal. And I emphasize a new normal, a better way of doing things. James Austin Health Center in Eden, we're open. We take new patients. I don't care if you're uninsured, underinsured, if you've got full health insurance, we take it all. And we can help you find resources to see us if you don't have health care insurance. We've been able to help in many different ways. Rockingham County has a lot of different services. The health department in Wentworth, and to that, there's integrated health, which has been a big help to James Austin and our community. Not a lot of people know about integrated health. Call me and I will tell you. We have Care Connect, which they've been awesome, helping me with patients that have no health care. And I mean patients that have a lot of comorbidities, like uncontrolled diabetes, uncontrolled hypertension. I mean hypertension, high blood pressure through the roof that you can't imagine, failing kidneys, kidney disease that's in some of the later stages, and these guys have had and girls have had no health care insurance. And Care Connect is helping me help them, helping them get their medicine, helping them get to their specialist. Contact James Austin Health Center, contact Caswell Family Medical, and we can help our community. We have the resources, and we have the support from other places in our community, even for medications and supplies. I'm looking forward to seeing my family. Looking forward to getting home. I've got a heart full of ideas right now, and I want to put them in play and take care of Rockingham County. So let's take care of each other. Put politics aside. This is real. This is scary, and we can knock it out. We can make it better, and I will over time. So love you, love everybody. So let's kick COVID's ass. That'll probably get edited. I'm not crying, you're crying. I ended up having to take an Uber to, my flight got changed, everything got changed. I was supposed to have been home by lunch Friday, ended up getting home I think around 6 o'clock. The flights were super fast, no delays. Once that plane was loaded, there was no holding pattern on the runway or anything. They backed out, took off. So my flights were fast, went from one flight to the next. I had enough time to eat in Charlotte, jumped on my plane, got home, came home, threw all my clothes in the washing machine, disinfected the whole house, took my shower, and then went and picked up my son. And we social distanced while I was waiting on my COVID test to come back. He stayed in the opposite room. We were able to see my TV from, he could go in another room and watch. So we watched TV together, and we went outside and played and did different things, worked in the yard. But there was some concern about, I did not want him to if I had the virus to give it to him. So I made every possible cautionary, anything I could do to prevent him from getting that. And I've been fine. My COVID test come back negative. I'm hoping to get the antibody test and go from there. I want to cover some topics in healthcare. I want to show our community, show it off. There's different places I want to introduce, and there's different people I want to interview, and I want them to be able to speak to our patients in our community and expand our health in Rockingham County. I want to learn more about what Rockingham County can do for its farm to table, its fresh foods, its farmers markets. I want people to speak up and introduce themselves, and I know they're out there. I know there's good people, good-hearted people that can really bring something special to our county, and Caswell County, and Alamance County, and Guilford County, and across the border into Virginia. I even have patients there that come down to see me. So, and I want to showcase the trails, our parks, and places like that. So if you're interested in that, reach out, leave some comments, and if you're willing to if you'll watch these videos that I make, let me know, and we'll see how it goes. Thank you for this experience and following me. I've enjoyed it. I hope I've brought some good information and drove home the point that social distancing is important. We've got a few more weeks that we need to do this. We don't need to open up like some of these states are about to do. I'm hoping they'll change their mind. I'm waiting on our Governor Cooper to make an announcement on North Carolina and see what's going forward. I will talk to you later. Bye.